My name is Matthew Hill. I'm a neuroscientist and a professor here at the University of Calgary, and I'm also the chair of the Mental Health Initiative in Stress and Trauma. It has two main goals. The first one is an education and outreach goal, and the other one is a research-based goal. The entire initiative is really focused on understanding how stress and trauma, both emotional and physical, can influence mental health. And so we're really trying to understand both advances in the basis for how these mental health issues develop, but also look at novel forms of treatment for these areas. We have kind of an umbrella of three main areas that we're focused on. The first one is major depression and suicidality. The second one is post-traumatic stress disorder. And the third one is post-concussion syndrome associated with mental health conditions. The education and outreach component of the MIST program is really focused on bringing awareness to both the community and especially the corporate community in Calgary about the relationship that exists between stress and trauma and the development of mental health issues. And we're doing a lot of preclinical research to understand how things like concussion and head trauma can change brain circuits that are involved in processing stressful stimuli or understanding emotional processing. On the clinical side of it, we're focused much more on treatment interventions, often combining existing treatments that have some efficacy but seem to work better when you put them together. And so all of the clinical trials in this space are looking at different interventions using things like non-invasive brain stimulation, even hormone supplementation therapy. One of the more exciting ones is really looking at the use of psychedelics in the treatment of post-concussion syndrome. This kind of evolved again out of a grassroots thing where a lot of individuals who had experienced concussion and were developing mental health problems in the aftermath themselves began using psychedelics and were finding benefit from it. In addition to that, we're also looking at various cannabinoid-based approaches as well. We know that a lot of individuals who have post-traumatic stress disorder use cannabis as a means to help regulate some of their symptoms, particularly the sleep and nightmares component of it. We have been looking at some other research in that context with drugs that modulate the cannabinoid system in the brain and see if those could be novel approaches to treat aspects of post-traumatic stress disorder or associated anxiety disorders. Everything that we're looking at is already Health Canada approved treatments that we're now combining together or taking into new areas that have never been tested before. The benefit of that means that if this works and we do find positive signals through the clinical trials that we're running, that means we can rapidly convert that into treatment options for patients because we're looking at things that are already on the market and accessible. So clinical trials are incredibly expensive to run. The process of acquiring grant funding takes substantial periods of time, upwards of 2 to 3 years sometimes. On top of that, federal grant funding really does not support innovative high-risk research. The advantages of philanthropic support is once the money comes in, we're able to immediately start the trial. And so this allows us to accelerate the rate at which we are able to understand if a treatment is going to work or not. One of the main priorities of MIST is doing a clinical trial purely on suicidal ideation and suicidal risk, and understanding if coupling these treatments in addition to improving depression can also actually have a direct effect on reducing suicidal risk. We can push the needle with philanthropic support and actually run trials on these kind of difficult areas to get support for that are really high risk, but if they do pan out, the benefit is immense.